As you grow older, your healthcare needs change, especially if you have multiple chronic conditions. At Geriatric Medicine of Boulder Community Health, they offer care specifically for patients 65 years and older who have medically complex needs. Care designed to enhance your quality of life and help you live with as much vitality, independence, and dignity as possible. We spoke with Dr. Elizabeth Lysette to learn more.
Geriatric medicine at BCH, or Boulder Community Health, is a new department. We started in 2024, and we've got 5 providers. There's 3 clinical physicians, and there's 2 nurse practitioners, and all of us have geriatric medicine training. We work in dyads, so the typical patient has both a physician and a nurse practitioner team, and we're all supported by some clinical RNs with geriatric expertise. And so they are mostly on the phones, helping keep patients out of the hospital, understanding their medications, communicating with the physicians on an as-needed basis throughout the day. We've also got support from front desk staff and medical assistants that are all good at speaking loudly and deeply to our patients that are hard of hearing, making sure things are printed in the right size, making sure patients have the access they need to our clinic. Geriatricians are experts in multiple medical complexities. So a typical geriatric patient is not just old, but they also have multiple conditions. Think about things like congestive heart failure, or chronic obstructive pulmonary disease that we call COPD, or dementia or cognitive impairment, osteoporosis, frailty, polypharmacy. Those are things that are not just a one-time diagnosis. A younger person might get an infection like cellulitis and get it treated and it's gone. But an older person starts accumulating diseases or disorders that are managed longitudinally. And when a person really needs a geriatrician is when there are multiples of those. They're not just older, but they have all of those high intensity chronic conditions. And the geriatrician is able to take the advice of maybe the smartest cardiology advice in the country that knows exactly how to preserve someone's heart function. But they also look at the advice from the pulmonologist, the rheumatologist, the endocrinologist, to take all of that amazing wisdom and to put it in an overlay for that individual patient to say, this is how you prioritize your health. And the most important thing we look at is that individual patient's goals. Some patients really want longevity. Maybe a person in the sunset of their lives is hoping for 5 years of longevity to see a particular grandchild graduate from college. They may not care that they can walk their dog or pay their bills, but they really want to be present. And somebody else might care completely that they have dignity at home and they can walk and take care of themselves. Those goals are totally different, and a particular subset of complex conditions aren't always treated the same because the different patient goals require a different treatment plan from a geriatrician. So we help patients prioritize their treatment plan so that they can get what they want within reason from their health span. I think what makes BCH unique about tailoring end-of-life care is specific to the individual. We have been working with our whole network to make sure all providers, inpatient and outpatient, both specialty and primary, focus the patient on what's important to them and clarifying their goals. And once we can do that, we can offer actually amazing cardiovascular care all the way to hospice and medical aid in dying and everything in between. And by understanding patient goals at all levels of the system, we can really tailor the care of the patient for exactly what they're hoping for. In geriatrics, we are really invested in the stories that people have because it helps us understand why they want what they do. There are so many layers to someone's family or their interests that help us understand when to see a high intensity specialist and maybe when they don't want to spend the time doing that because their values are not with medical interventions but with time with their loved ones. So we often are doing large family meetings where there are multi-generations in one room, understanding how to optimize someone's health. The other thing we try to do is think about what dignity is to the individual. That's different for everyone. Some people it's cognitive, some people it's physical, some people it's how well they can contribute or what they have contributed already and how it's preserved. And so those kinds of things are important. I draw a lot on Atul Gawande. He's a wise thinker in the world of aging and medicine. And he talks about medicine really needs to focus on well-being, and well-being is about the reasons that one wishes to be alive, and that maybe we should get away from just survival because that doesn't always preserve dignity. So in geriatrics, we're really drilling down on how to focus on the individual and their goals. I'm a geriatrician because I find joy in the stories that patients have to tell. A 30-year-old has a really short lifespan compared to a 90-year-old that has had amazing diverse experiences, and those stories are what give them the competitive advantage of wisdom.
The geriatric specialists at Boulder Community Health work closely with you and your family to address your medical, social, cognitive, and emotional needs. They keep your unique life goals in mind and offer strategies to support your well-being.